One of the toughest challenges for a smoker is trying to quit. Part of the problem can be how long they've had the habit. A lot of smokers first light up when they're just kids. Doug Johnson has tips on quitting and ways to protect your child's health by stopping the problem before it starts.
About 47 million American adults smoke. Most of them picked up the habit when they were teens. The Centers for Disease Control says that every day, 3,400 teenagers smoke their first cigarette, with 850 of them becoming daily smokers. Rhonda Thomas, a technician at Baptist DeSoto Hospital, was one of them.
I started smoking about 14 or 15 years old. Peer pressure, all the kids were smoking, and it's the cool thing to do at the time.
The human cost of smoking is high. Government figures suggest 443,000 people will die prematurely this year because of smoking or exposure to secondhand smoke. Smokers know that, and many try hard to quit.
Yes, I tried several times. It is the most difficult thing I've ever done. And anybody that has ever smoked can tell you that it's the most difficult thing they'll ever do.
There's help out there for smokers, including classes offering support, tips, and other help. This one is held every quarter at Baptist Hospital DeSoto. The nurse who leads the classes, a former smoker herself, says it takes most people several attempts to quit for good.
The person has to want to quit smoking for themselves. It has to be a personal conviction. Even if your physician tells you if you don't quit smoking, you're going to die, if that patient is not ready to quit smoking, they're not going to.
Nearly all smokers, 90%, started before they were age 18. In fact, the average age of a new smoker is only 13. And speaking of years, quitting, no matter how many attempts it takes, can add years to your life. The American Cancer Society's annual Great American Smokeout happens every November. The event urges people to quit on that day, or at least make a plan to quit. Parents can help young people avoid having to go through the challenges of trying to quit by helping them avoid smoking in the first place.
The main thing I did with my children was just talk to them honestly, just bring them home literature and show them what smoking can do to your lungs and to your heart and to your arteries and the whole vascular system, not just the smell of it and how it causes more wrinkles on your face. Show them, just be honest with them and show them exactly what happens to smokers. And my kids saw how difficult it was for me. They saw how I struggled. So that helped them not to smoke.
For more information on the smoking cessation classes at Baptist DeSoto, call 662-772-3000. For Smart Medicine, I'm Doug Johnson.